My name is Carolyn Coyle, and this is my project on the diseases of the cell for Wilson's disease.
Wilson disease, Diseases of the Cell project by Carolyn Coyle. Wilson disease is a genetic disorder arising from a mutation in the ATP7B gene, which codes for copper transporting ATPase2. ATPase2 is a protein involved in transporting copper out of the body. The resulting buildup of copper in the body from this mutation causes serious harm to many organs, namely the liver, the kidneys, the corneas in your eyes, and more. Also the nervous system and the brain. This results in cognitive and psychological problems in affected individuals. It is a recessive trait inherited from both parents, and it is also a lifelong illness that is usually diagnosed in early adulthood when symptoms first arise. Symptoms of Wilson disease can be both cognitive and physical. So in the brain, people suffer with speech problems, impaired thinking ability. Psychological problems include depression, anxiety, mood swings, and fatigue. People also experience bodily or physical or motor problems when they have Wilson disease, including clumsiness, difficulty walking, tremors, muscle spasms. This usually looks like flailing of the arms or trouble controlling their extremities. Kayser-Fleischer ring in the eyes is a copper-colored ring that shows that's shown in the eyes around the iris. So that's a telltale sign of somebody who might have Wilson disease. People also suffer from loss of appetite and abdominal swelling when they have Wilson disease, although not all individuals experience all of these symptoms, and they can be to varying degrees. So this actually makes it very difficult to diagnose Wilson disease sometimes if it's not known to be in the family, because somebody who has depression, mood swings, and speech problems, your first thought would not be a buildup of copper in their body. Same thing with muscle spasms and loss of appetite and things like that. That can be a lot of different things. So diagnosing Wilson disease can be a bit of a challenge sometimes when you're just looking at symptoms. And we'll get into how it's diagnosed later on in a couple slides. But it is a challenge sometimes, and it is a somewhat rare disease. It's become less rare in recent years. Recent studies have shown that it's actually more prevalent than we thought, but it can be difficult to really pinpoint that Wilson disease is the problem when all you're looking at are symptoms like this. So as I mentioned in the last slide, Wilson disease is kind of rare. Originally, older studies point to a 1 in 30,000 type of prevalence. Newer studies, according to Yale Medicine, newer studies are saying that 1 in 7,000 people worldwide have Wilson disease, which is much less rare than we thought, but not quite as prevalent as certain other diseases. As I mentioned, Wilson disease can be hard to diagnose because it is not extremely well known in the medical field or in as public knowledge either. And its symptoms are rather common to other diseases, as I mentioned. So diagnosing Wilson disease, it's mostly genetic testing. However, blood tests and urine tests can also measure levels of copper in your body if Wilson disease is suspected. And liver biopsy can show copper buildup as well, because in the liver is where most of your copper builds up. That's why there's a lot of risk in Wilson disease with liver injury, liver failure, things of that nature, because the copper builds up in the liver. And it does not have anywhere to go, as the mutation prevents copper from exiting the body like it normally would. People also undergo tests for brown rings in the eyes, like I mentioned before. Those copper-colored rings are a telltale sign of Wilson disease, so you can have tests done with specialists who know what they're looking for to find out if you've got Wilson disease, although genetic testing and other lab tests are more common. Because Wilson disease is a recessive trait, the inheritance pattern requires that both parents have at least one recessive allele for Wilson disease to be able to pass it on to their offspring. So we could have two heterozygous carrier parents who each pass that recessive allele and their offspring has Wilson disease. We could have both carrier parents give no recessive alleles. We could have one recessive allele and the offspring is a carrier. It really depends. There's a 50% chance of two carrier parents having a child that is a carrier. There's a 25% chance that that child would have Wilson disease. If one parent is a carrier, the offspring can still be a carrier for Wilson disease. There are lots of different possibilities, and it really just depends on what the parents' alleles are. Genetic testing can be done to diagnose Wilson disease in the parents and in the children, and it can be used to help families or couples plan their future families and gauge that risk factor of what they might be passing on to their offspring. Although we need copper in small amounts from food in our diet, large amounts of copper stored in the body is very harmful to various functions and various organs in our body. Large amounts of copper stored in the body can lead to acute or chronic liver failure, hepatitis, problems with vision as those rings affect the corneas. The copper in your eyes is bad for your vision. Kidney problems and neurological disease that can be progressive and lifelong and very serious if Wilson disease goes untreated. And this is especially bad if symptoms aren't detected until later in life. So for adults, the neurological problems can be a lot worse, especially if they're older adults just seeking treatment for the first time in their later years. The impacts on the brain can be really severe. Wilson disease has no known cure yet. There is a lot of research being done, a lot of clinical trials being done to try and find a cure, but as of right now, there is no known cure. Wilson disease does not really have any preventative technology besides genetic testing prior to having kids. Because it's a recessive inherited gene or trait, you don't really know that you have it until symptoms arise in adulthood. And besides genetic testing to see if you have it or are a carrier, there's not much else that there is out there to really help prevent the disease. You either have it or you don't. More research is needed to find lower risk treatments, which we'll talk about in the next slide, and to find a cure, because as I mentioned, there is no cure yet. Clinical trials are happening in animals and in humans all the time. There is a link at the bottom of this slide to check out some active clinical trials or some that are happening in the future that need some more active volunteers to participate. The primary treatment for Wilson disease is copper chelation, and there are 3 medications that are used for this. The first choice most of the time is penicillamine, which has very severe side effects, which limit the dose that you're allowed to take. It's not really recommended for long term, and the side effects can be very severe. So it's not always a great choice for people who are immunocompromised or who have other health concerns. The second choice that's a little bit more tolerated by most people but works a little bit less efficiently is trientine. It works kind of similarly to penicillamine, although it is a bit less effective. but it also has less severe side effects. So it's kind of a trade-off, and providers can kind of determine which one they think will be best, depending on the health concerns of the patient already. The third option is dimercaprol, which is rarely used because it's super duper severe, the side effects. So that's not used as much anymore, and it's really only used for severe cases and for short periods of time if it's really, really necessary, and the first two options didn't work or weren't as efficient as they should have been. Alternative treatments to copper chelation include zinc supplements, which inhibit copper absorption rather than chelating the copper out of the tissue or the blood when it's in excess. Your provider can also suggest that you limit the consumption of copper in your diet, and they can give you a list of foods to avoid, which includes red meat and other foods that are high in copper. In severe cases, it's recommended that you get a liver transplant, although this is risky and really only required in cases that are really severe. Treatments that are not yet approved medically, but are still undergoing clinical trials and are promising for the future, are tetrathiamolybdate salts, and genetic treatments are also being tested in animal trials as well.